Hello. Today I'm going to talk to you about marijuana. It's a very controversial drug, so my point here isn't to tell you to do it or not to do it. I'm just here to give you facts so that you can make an informed decision about it. According to the National Institute on Drug Abuse, cannabis is the most commonly used illicit drug in the United States. And for years, people have associated cannabis with recreational use and the fact that they get high. Though many people may talk about the effects of cannabis, it is important to understand that different people may have very varied reactions to cannabis use. But what is it? Cannabis is a drug that comes from the leaves and flowers of the plant Cannabis sativa. Cannabis can be found in different forms. So marijuana is prepared from the dried flowering tops and leaves of the plant, while hashish or hash consists of dry cannabis resin that may be light brown to almost black. There are different street names for cannabis. It goes from pot to weed, Mary Jane, bud, grass, reefer, herb, and so on. From the cannabis, we can extract two different components, the delta-9 tetrahydrocannabinol, or also known as THC, and the cannabidiol, or CBD. The THC is the psychoactive component, so basically it produces the high. It enters the bloodstream and makes its way to the brain. It then attaches to the receptors in the brain, which causes the high to occur in most people. And THC is present in the bud of the cannabis plant, which is why people tend to use these parts in recreational joints and edibles. While cannabidiol or CBD is and also interacts with cannabinoid receptors, but only THC causes the high, CBD does not. And manufacturers often extract CBD from the cannabis plant for medicinal use. So as you might have noticed, we have two types of marijuana. We have the recreational marijuana, which is high in THC, and we have the medical marijuana, which is often lower in THC and higher in CBD. And this medical marijuana can be used to treat conditions such as nausea, vomiting, and pain in AIDS. It also helps with increasing appetite. It reduces nausea, vomiting, and pain in cancer patients. It can control seizures in epilepsy patients. It can reduce pressure and slow progression of a glaucoma. It can also be used to reduce muscle spasm, pain, tremors, bowel dysfunctions, and more in multiple sclerosis patients. How is it consumed? So marijuana can be smoked or vaped. So this is the common joints. It can be ingested. That's what we call edibles. So cookies, space cakes, candies, drinks, and so on. It can be vaporized. So that's vaping. And THC absorption differs depending on the method a person uses. So for example, when a person smokes or vapes, the effects of being high occur almost immediately, so a few minutes, and then THC enters the lungs and bloodstream, and the user very quickly reaches their peak high after 20 to 30 minutes, and this stays for almost 2 to 3 hours. But when a person ingests cannabis in the form of edibles, it has to travel through the digestive tract, which slows down the process of absorption into the blood. So it takes longer for the effects to kick in from 30 to 80 minutes, and then much longer to reach their peak, so not before 3 hours. So the result of this delay is that a person can eat more than needed as they wait for the effects to kick in. So they should take care not to take too much while waiting for an effect, because the effect of marijuana is very dependable upon the dose. So at a low dose, people will generally experience much nicer symptoms than at a higher dose. And the thing is, THC level in the blood vary over time. In general, they will build until they peak, and once they peak, they start to work their way out of the blood through a person's urine or stool. As THC levels rise and fall, a person may experience very different effects from cannabis. During the peak, the person is most likely to experience the euphoric effect, which is commonly known as the high. So a state of relaxation, euphoria, altered time and sensory perceptions, and increased appetite. But as the THC concentrations in the blood begin to fall, a person may experience hunger, sleepiness, anxiety, or mild paranoia. The speed at which a person goes through these stages and which stages they experience will depend on several factors, including the method of use, such as vaping, smoking, or ingesting, the strain, the potency, dose, sex, physiology, frequency of use, and so on. But if a person smokes, vapes, or consumes too much cannabis, they may experience unpleasant effects, and this is what is commonly known as a bad trip. So these might include panic, psychosis, confusion, anxiety, hypervigilance, paranoia, hallucinations. So people who do not use cannabis regularly are more likely to experience these unpleasant effects from being high. Other clinical effects include an increased heart rate by 20 to 50% that may last up to 3 hours, and changes in blood pressure. So while the person is sitting, the blood pressure would be increased, and while standing, it would decrease. In healthy young users, these cardiovascular effects are unlikely to be of any clinical significance, but they present a risk to patients with heart disease. The acute toxicity of cannabis and cannabinoid generally is very low. So there are no cases of fatal cannabis poisoning in the human medical literature. In other terms, you can't really OD from cannabis. But what is also important to note is that it impairs driving performances. So while on marijuana or cannabis, one have a higher risk up to 2 times more chance of being in an accident. So it is very important not to drive while on marijuana. So usually you say don't drink and drive, don't smoke weed and drive too. Other clinical effects of marijuana are linked to the way that it is consumed. So marijuana smoke contains the same toxins, carcinogens, and irritants as cigarette smoke. So on the long term and for a daily user, it can increase the risk of pulmonary complications such as chronic bronchitis and an increased incidence of respiratory and head and neck carcinoma. Another effect of marijuana is that it lowers the sperm count and testosterone effect, but there are no evidence of effect on sexual performance or fertility. Something that I would like to talk about today is that people often say that marijuana is a gateway drug. So that means that they say that people usually start with marijuana and then go on to harder drugs, such as heroin or LSD. While users of heroin and LSD are more statistically likely to have used cannabis in the past, this correlation does not imply a causation. So it's not because we don't have any clinical evidence to show that it's because they started with marijuana that they ended up doing heroin. And for most likely, it's not a gateway drug, it's a terminus drug. So most people will just use marijuana and then stop. But to talk about the theory of the gateway drug, we can say that an early exposure to cannabinoid might change the reward system of the brain, therefore making the person more vulnerable to addiction in the future. So this is the debate about the gateway drug, but it is important to know that for most people it's not. What is actually proven is the cannabis-induced psychosis or schizophrenia. So cannabis use can precipitate psychosis among vulnerable people and exacerbate symptoms or prolong mental illnesses. So it is very important that if you have any history of mental illnesses in the family, especially schizophrenia, that you steer clear of marijuana, because even one joint in a vulnerable enough person can induce schizophrenia and psychosis. As for depression and anxiety, as I told you before, And you might remember the adverse effects of cannabis are the feelings of anxiety, paranoia, tiredness, and low motivation, which describe a depression. So cannabis increases anxiety, depression, and suicide attempts. Now I'm going to talk about some myths and correct them with facts. So the first myth I'm going to address today is that there are no long-term effects of marijuana use. My answer to this is the same as when someone asks you, can I try marijuana? So what's important to know is that the brain continues to develop until the age of 25. So marijuana can affect youth very differently than adults. Marijuana impairs coordination and judgment. It decreases a teen's cognitive abilities for as long as several weeks after usage. If used during youth, it often results in chronic weakened verbal communication and learning difficulties with a shortened attention span. Association with youth in the youth and development of mental illnesses and psychosis later in life are noted too. And the early use has also been linked to depression, anxiety, and suicidal thoughts among teens. So research strongly suggests that marijuana use during adolescence and early adulthood can damage the part of the brain associated with learning and memory. So it is very important, if you must try marijuana, to delay that the most possible, because regular marijuana use during adolescence can lead to a reduced IQ scores, poor school performances, and a higher school dropout rates. The second myth I'm going to address is that secondhand marijuana use is safe. Actually, it's just like secondhand smoke from tobacco. It is just as dangerous, because, as I told you before, the smoke contains the same toxins, irritants, and carcinogens as tobacco and wood-burning smoke. So it can damage the lung. So you have to be safe about it. But when I say damage the lung, it's for a prolonged use and a prolonged exposure, and a daily one too. So it's not from just one time that your lungs would get damaged. Finally, the third myth I'm going to address is that marijuana isn't addictive. So let me get this one straight. So marijuana is addictive, and chronic marijuana use can lead to addiction. Research shows that approximately 9%, so 1 in 11 of those who use marijuana will become addicted. And this goes up to 17% in those who start using while young, so in their teens, and increases to 25 to 50% of daily users. So a chronic marijuana use and long-term marijuana use can lead to dependence and addiction. But what's an addiction? So people with marijuana addiction, or if I might choose the medical term, cannabis user disorder, have 2 or more of the following problems occurring at any time in the same 12-month period. They don't have to be at the same time exactly, but within the same year. And as logic might suggest, a higher number of criteria met correlates with a more severe disease. So addiction, what I want you to remember about it is this simple definition. When a person cannot stop using marijuana, even though it interferes with many aspects of his or her life. So the impact on the quality of life is what defines an addiction. People will start choosing more marijuana than they plan to for longer than they intended to. They will have a persistent desire to stop, so they will try to stop, but they won't succeed. They will spend a lot of time getting marijuana, using it, and then recovering from its effect. They will have a craving for it, which will lead them to sometimes fail to fulfill obligations such as going to work, going to school, remember family events, cleaning their home, and very basic stuff. So they will keep on using marijuana, even if it causes or worsens problems in their relationships with other people. They will give up on important activities because of their marijuana use. So maybe they like to do sports. they will stop doing so. If it they will stop doing their sports to consume more marijuana, for example, and they will keep on using marijuana in situations where it's dangerous to do so, such as while driving. They keep on using marijuana also despite knowing that they have a persistent or recurrent physical or mental problem that's likely to have been caused by their marijuana use. And they will finally develop a tolerance, and tolerance is defined by, let's say, you need more to get the same effect, or the same effect that you used to take doesn't produce the same effect as before. So this amount used to get you high, now it doesn't anymore. And finally, the last criteria is the withdrawal symptoms. Cannabis withdrawal is defined by 3 or more of the following, developing within 1 week after cessation. So people would have a feeling of irritability, anger, aggression, nervousness, anxiety, sleep difficulties such as insomnia, decreased appetite or weight loss, a feeling of restlessness, a depressed mood, and at least one of the following physical symptoms causing significant discomfort. So abdominal pain, shakiness, tremors, sweating, fevers, chill, or even a headache. When a person is diagnosed with a marijuana addiction, we have very different ways of helping. So it can go from counseling and support groups to a more structured plan, which includes behavioral exercise and regular surveillance. But the most important thing to fight off addiction is to be informed enough to know when help is needed and brave enough to ask for it. So that was it for the marijuana use. You can follow us on social media at Lamsa Lebanon. We also have our website that you can visit, lamsalab.org, where you can find our forum. It provides you with the opportunity to share your personal stories and experiences. It is not for medical advice, but you can comment and ask your questions at any time anonymously. Thank you.